Hey, everybody, welcome to the Plunge podcast. My name is Noni Mugera, and this is season two, episode two of the Plunge podcast. And this is where we have conversations that matter surrounding better mental health, healing, transformation, and self development. Now, today's topic is a little bit touchy, not even a little bit, it's super, super touchy because we're talking about therapy, embracing therapy. And the question is, are you making your mind a priority? And I'm not gonna lie, this is gonna be a little bit hectic for me because, and hectic in a very good way. I have my therapist Lucy
Hi.
at my podcast today. Lucy Kimeu, practicing psychologist.
Hello, how are you today?
I'm fine, thank you. How are you, Lucy?
Good, good.
I, I can't. First of all, I have this tissue here, just in case I start crying because this is the most nervous I have ever been. Um, uh, on any episode ever because it's because of you that I'm here.
Oh,
So, man, like I. All right. So, I mean, just to give like guys like a context, I started therapy last year in October, you know, as you know, obviously. And then it didn't work out with myself and the said therapist
hmm
because, I look very hard on the exterior and she was giving me tough love when really like all I needed was like very soft love. And you
Mm.
came in and you literally just changed my life and my perspective, and
Oh,
you gave me the courage to even start this podcast. So
oh my.
without further ado, please introduce yourself, Lucy, and what you do. Tell us about like your journey and like what brought you to becoming a psychologist.
Wow. Good morning. Uh, my name is Lucy, like you said. I'm a practicing psychologist for 14 years now.
Hmm.
Um, I practice more of clinical, but I can also do counseling. But I love clinical. It's
When you say
eh,
clinical, what do you mean?
clinical, the assessments, coming up with the diagnosis, coming up with treatment plans and progress. It's like a thrill. Counseling, I do, which is also good.
Mm-hmm.
And it's been quite a journey. I
Mm-hmm.
actually started with counseling.
Mm-hmm.
And when I first went to my undergraduate
Mm-hmm.
at Kenya Methodist University,
Mm-hmm.
uh, you hear the way guys normally say, your parents force you to do this, this, this.
Yeah.
So I had to do journalism. I had to do this thing.
Oh,
But
really? You would
my
have
ma,
been here with
that's my,
me.
and I was like, forget.
Mm-hmm.
So she was like, okay, you'll do education. I'm
Mm-hmm.
thinking, what? Me a teacher? That's a
Mm-hmm.
lie.
Mm-hmm.
So we reached school. Me and my dad were good friends, were very close. I told him, I don't think I want to do education, by the way. This is not a plan. We're
Mm-hmm.
already in school. I've reported. I'm supposed to start class next week.
Mm-hmm.
He tells me, but let's go see what we can do about this vibe. So we're
Mm-hmm.
like, so. So we go meet the dean. He says she can do Bachelor of Education, but she
Mm-hmm.
can major in counseling. So I
Mm-hmm.
did Bachelor of Education counseling option.
Mm-hmm.
So the first semester, campus was party after party. So of course, the first semester, the GPA looked the way it wanted to look like.
Yeah.
And then when I came back second sem, I realized guys kept coming. Oh, my boyfriend's really. So I just listened. So one girl said,
So they
"You're
kept
really."
coming to you in
Mm,
particular.
I'm like, "Mm." So one of them said, "You're really good at listening and helping people."
Mm-hmm.
I'm like, "Hmm." In my head, this degree was my mom's. Eh?
Right.
So I'm like, what? Really? So we did the second sem. The
Mm-hmm.
GPA looked better.
Mm-hmm.
I was like, not so bad. So by the time I was going to second year,
Mm-hmm.
it was like, I can try this. Let's see how it goes. So I
Mm-hmm.
finished my undergrad. Then I got an opportunity to do counseling at Karen Hospital. And my mentor, Dr. Rachel Kangether. And that's how I started loving what I do.
Mm-hmm.
It became a thrill. Now that's how the clinical psychology came in
Mm-hmm.
because I learned counseling, but my practice is more clinical,
Mm-hmm.
having worked below a psychiatrist. So that's how clinical psychiatry, that's how counseling became, psychology became. I did my master's, finished, and I loved what I was doing. Initially, I used to be scared because Africa, I mean, in Africa, mental health is not embraced.
Yeah.
So I was like, how is this supposed to work? Where do I get a job? But I can say just by God's grace, I got to where I am today. So I kept helping. And like you guys, like how you said, Noni, thank you for being there. Thank you for listening. Oh my God, I feel better.
No, we would not be here.
No.
Can I just make it? Yours is not listen. No, the Plunge podcast
Would not be here. Oh my.
Yeah.
So we went on and everyone would come like, oh my God, thanks. I'm like, not so bad. Let's do this. So it became a part of me. Initially, when I start therapy with clients, that those I go, wow, will I be able to do this? Along the way, I'm like, but then where is that? Oh, yeah.
You know, you say that with me. Yeah?
I know. I'm like, Jesus Christ. So with time, it became who I am.
Yeah.
And I love what I do. There are many people hurting out here and don't even know who to turn to. What do I even say? So for me, I make it chilled out. I don't. So the way you meet a therapist who's one of those big specs and I was chilled out. Let's just do this. You want to speak English? Go. Do you want to speak whatever you want to speak? It's fine as long as I understand. We are good to go.
Yeah.
So it's been quite a journey, and I love what I do, and I feel it's the way we always told. What is your purpose? I feel that's my purpose here.
Your life purpose is helping people.
Just let's help and be there for others because life is hard as it is.
Yeah.
So why not have someone to listen to you?
Yeah.
Yeah.
I think I would probably just ask you, how do you know, as someone, just any normal person, how would they know it's time for me to start therapy?
All right.
How do I start? How do I even know I need therapy?
We struggle with many things in life. And first thing, when you're never so sure of yourself, the moment you start doubting yourself, am I good enough? Self-doubt, low self-esteem, sleep. Sleep is very key. And we take it kindly. And you're like, I didn't sleep yesterday. I took a cup of coffee. Why are you not sleeping? When I sleep, I wake up, I feel tired. That's not supposed to be. There's a difference of sleeping and resting. Sleeping, you can sleep, but you're not rested. You're still tired. You're exhausted. When you see people, you're just tired. Like, guy, I can't. You know? Guys come, you're like, hey, you people, I need to go. Basically, it's like a switch. So people have learned to live switch on, switch off button. So I reach where the people switch button. They go home. Oh my God, that was so hard.
So it's like, let's say you when you're seeing the world, aka when you're going to work, hi everyone, and then you go back home.
Not interested in things you were doing. Let's say maybe one loved reading books, going to the gym, exercising, hanging out with friends. All of a sudden they're withdrawn, isolated. You want to keep to yourself. You don't hang out with people anymore. Maybe you loved, let's say what you're doing, the podcast and stuff. You lose interest completely. You have to push yourself twice as hard, which is even harder, pushing yourself even harder. So that's the point where you just seek therapy. And, people think therapy is just sitting and listening. And may I go sit to someone talking to me, listen to them. No, mi niko sawa. Twende hapa West tuchape jini moja tuko tu sawa. You see, you're just putting a elastoplast on a wound. And eventually, it will come off. The wound is still there.
The wound is still there.
Yeah. So you need to just sit and unwind and work on whatever it is. Like I always tell my clients, like we see her cat playing with Uzi Akshona, it'll play with it. Eventually now it looks so stuck. Like, so what am I supposed to do now? Then it looks at you. Then of course the Kenyans here will go afayani. Then that's not therapy. We start undoing all the irrational thinking patterns, learned behavior, slowly by slowly, as you learn more about yourself. And when you come out through therapy, it becomes a very different kind of experience. But also one thing is that the different generations. There's millennials, Gen Z, and the ones who are before millennials. What are they called? Those
Gen
ones.
X,
those
baby
ones.
boomers.
Those ones. Now, generation Gen Z are the ones embracing therapy. For them, it's a lifestyle. And I see many of them. I'm telling you, for them, I meet many of them and they tell me, but their therapy is like how you go to the gym. And I'm like,
are they embracing therapy, or is therapy like a thought process that they're like, I probably should do it, but are they actually doing it?
They're actually reaching out.
Oh, wow.
They're actually, hi, I need therapy, but I'm not sure how much you charge. It's now when you listen to the history, you're like, okay, let's just do that. It's okay. There are those who can pay you, there are those who won't. But they embrace it and they tell you, yeah, I need a therapist. I have a therapist on speed dial. Me, the therapist, mine, I have to call. She's not on speed dial. So it's the different generations embrace therapy
And why do you
differently.
think it's so? Why do different generations embrace therapy differently?
You see, for the Gen Z, they lack the basic life skills as we had when you were growing up. You know,
Like what?
like problem solving, time
Critical
management,
thinking.
critical thinking. Zero.
They lack.
They lack because as the parents, as the millennials, are busy looking for money.
So you're saying, well, I don't. Is Gen Z, are we the parents, or it's Gen X that are the parents for baby boomers? Because
Millennials
our
going this
parents.
way.
Sorry for Gen. Oh my God, this generation thing is confusing.
Confusing.
All right, so
Let's say
Gen
millennials backwards.
X, which
That
is
way.
Gen X. Okay, so basically, you're saying the parents for Gen Z were busy preparing a lifestyle and giving Gen Z a good life
Yes.
that they were not available to instill emotional competency to do life.
Yes.
So that's why they're seeking therapy.
Therapy, yes.
But I mean, I would also just say the same for us. I mean, okay, our parents were there. I'm a millennial. Our parents were there, but they were not woke. You know,
Yeah.
they were not woke. Especially for me, I grew up with a mom who taught me independence, you know, and I love my mom for it. But I feel sometimes like I lacked that softness, you know.
Yes, there we go.
Okay, I'm shifting this conversation from
There
Gen
we
Z
go.
to millennial,
So-
but I think my question is is it that different generations have different needs,
Yes.
or is it just one core need that was experienced differently?
It's one core need that has been experienced differently. Like if we look at, let's look at ages between, let's say 30 and up, let's say 30 to like 45, 50. If they were asked to deal with pain, like say trauma, their trauma is dealt with drinking alcohol.
Shots. Yeah.
Let's go down Palachini.
Yeah.
Ta-da, we come back, we'll be
Yeah.
fine.
Yeah.
Now these others are using the same thing. Now let's say the between 16 to around 25, 28. They'll try the alcohol for a bit and realize,
This
So-
is teenagers to
yes.
30.
So they'll now use it to try numb pain for a bit, but seek therapy. The others don't.
So
Why
that's the
would
key
I?
difference.
Yeah. Why would I have to pay someone to listen to me? So we just go to the club,
Or
listen
like,
to music.
I mean,
we move on.
I think also my thinking would be, if I wasn't doing therapy, I think my thinking would be, as you have made it this fine life,
There
and
you
see,
go.
I've been able to handle,
Exactly.
I've handled managers who hated me, husband who left me, I've given birth. I mean, what are you going to tell me that I don't already know?
Exactly. So then they'll come meet me,
Yeah.
and they go like, "Why do you look like you're 25?"
Yeah.
So it becomes also
Yeah.
quite confusing. So you tell them, "I've done therapy for 10 years." What? Really? So it's how we embrace therapy. Therapy isn't a place where you're judged, a place where they go, a place where maybe you'll talk to someone and share information out there. Counseling is a profession which is in the medical field, and there are values and ethics we have. So confidentiality is key. Yeah. So therapy should be embraced. It's good to have therapy. It's good. Been there, done that, going for it. So
You just told me you're going for a therapy
I'm
session
going for therapy
after
session.
this. So therapists need therapy.
we need therapy too.
Yeah.
Yeah. Because we're like a cup.
Yeah.
If we keep filling in, it'll overflow. So how does it overflow? We won't sleep, you don't eat, you lose interest, you're irritable, you have outbursts, loss of interest, withdrawn, isolated. You're just not there. Eventually, it's very easy actually to develop suicidal ideations. And if you look at Kenya today, many cases are out here, but because of the myths in Africa, people are not really willing to have the conversation. It was there, but not as much. But again, Why do we have to reach where people are suicidal for us to talk about mental health? Why can't we start now? Why can't we just embrace it and not reach there? Because we've had many suicidal ideations, many suicidal attempts, and actually people dying by suicide. And statistics are showing that most people who are hurting are men. And November is mental health.
Most people who are hurting are men.
Most people who are dying by suicide are men.
Most people committing suicide.
Dying by suicide.
Dying by suicide.
Yes, are men.
Are men.
For us ladies, it's attempt.
Attempt to commit.
Yes. So we attempt to see, by the time you're attempting, it's a cry for help. But for the man, it goes all the way.
Is there a reason why?
You see, in Africa, we always told the man has to, quote unquote, kangumu, man up.
Men don't cry.
Men don't cry. Kangumu. For how long will you be that hard?
It's like
you'll
toxic
break.
masculinity.
Yeah, you'll break down. Seek help. Just reach out. When they break now is when now they actually go all the way, because at that point they're helpless and there's no hope and they've isolated themselves. They've pushed everyone away. They've put a plastic face that, everything is fine, but they're breaking inside. So what we advocate as mental health practitioners is seek help. Just seek help. I'm struggling. I don't know what this is, but I'm struggling. Please help. There are many, many, many areas you can reach help depending on how your pocket is. I think I can just say it like that.
But like when you say seek help, that process of seeking help, because even for me, reaching out to a therapist, and then she was so harsh. Yani, she gave me tough love that I was like, okay. Maybe this therapy thing is not for me. I literally quit. I'd say, as you said, December came and I was like, I just said, F this thing and I'm going to take shots. And I drank all through December, all through the beginning of the year. And I started the year and the beginning of this year, excuse my language, was so shitty. And I was like, oh my God, you know what? I should have just stuck to this thing. Maybe I would have been better.
Yeah.
And I think that's probably, like, it took me being very, very low to reach out and start therapy and ask for help. So, like, can we talk about that that stage where, like, I feel like I should start for help, but like I should look for help, but like like you're pacing, like you're on a cliff, you're like, should I jump? Or how can someone navigate that stage or in life so that I can actually call you and book and show up? Because Lucy, there's a time I would just lie. I would just say I have work because it's so tough. Therapy is tough, and people, we need to also be. So we're talking about two things: that stage, and then starting the process.
It takes courage because it's fear of the unknown. All right, and fear is limiting. It's like crossing a road. Yeah. If, for instance, I'm from Kadonzweni, I don't know why I use that word. Let's say Makueni, farthest corner, it's called Kadonzweni, yeah? And I come to Nairobi, CBD. Where? I've never seen so many cars, bus, wood, tuk-tuk, piki-piki. Of course, I'd be like, by the way, no.
Yeah.
So you'd need, as I cross the road, I'm going with the crowd, so I'm like, wait. So we crossed the road, the first one. I'm like, oh, I did it. I'm not knocked down. Next time, courage. Let me just try. Let's see how. So you put the first leg in. You come back behind.
So you do it afraid, even.
Fear.
Yeah.
But it takes courage to say, let's do this. Let me just try. Let me just try. That is it. Let me just try. And I'll cross the road and I'll go to where I was going. Maybe I was going to Ngong Road. I'll reach Ngong Road and go, Allah, hey, I've reached.
We made it.
Hey, I've made
tough,
it.
But we made it.
It was no joke. That's how therapy is. Taking that one step. Let me just try it. And it's okay to change your therapist because therapy, A therapist and the client have a relationship. We call it a therapeutic alliance. Therapeutic relationship.
It's a therapeutic alliance.
Yes,
so
alliance.
Me and you, we have a therapeutic alliance.
Relationship. It's like a relationship.
Yeah. It is a relationship.
It is a relationship,
Yeah.
right?
Yeah.
So a relationship where we understand each other. A relationship where I get to understand you and where you're coming from. And then when you're also going through therapy, that a therapist will keep pushing you to areas where you are scared of. Because that is what is holding you back.
Out of your safety net.
That was your safety net.
Yeah.
Comfort zone.
Comfort zone.
Then you go down to how many people are living on comfort zone because of the fear of, oh God, then what happens? And then what if I don't do it? And then what if? It's the what if that holds you back. All right? There are things that we can go through all the way from childhood to adulthood. We always say your childhood always defines who you are as an adult because it's where it molds you. The attachments you develop, how you learn to handle stress, how you learn to survive comes from childhood.
It's really good that you brought that up because does everyone have childhood trauma?
There's something you go through somewhere that will traumatize you.
So it doesn't mean you got it from your parents or caregivers, but at some point in your childhood. Because I think for a very long time, I've always, and I don't think I'm alone in this, I've always thought childhood trauma means my parents traumatized me or my caregivers traumatized me or I grew up in an abusive home. And there are a lot of people have grown up in abusive homes. But like there's also people who their parents were relatively healthy parents and they had like a healthy upbringing. Do they need therapy? Do they have trauma?
Trauma doesn't necessarily have to come from home.
What is trauma?
Trauma is, in layman's language, how to explain it? It's an emotional, psychological wound.
An emotional
and psychological
wound.
All right. For instance, Noni, today you tell us we go to a hike. Ngong Hills. Don't think about it, by the way. And we say, let's go. So as you're climbing the hill, I fall and hurt my knee. Then I get a wound. So as it keeps healing, I start, there's a weight. It's itching.
Yeah.
So I start, let's see how it is. Let's see. Then, ow! Now that wound is what we have emotionally and psychologically when we go through something very scary, something very devastating, and it doesn't come from home. All right?
It doesn't have to come from home.
You can even get it when in school. Yeah? You can go, maybe you were in Riara group of schools, and then you go to a high school, and you go, what? Boarding. Boarding itself is scary. You have to wash your own clothes, you have to hang line, you have to wake up at 4, you have to, and you're thinking, all your uniform is stolen, you're left with nothing. What?
You're being bullied. Boys.
You've reached boys.
I'm just remembering the things I used to like in high school. Boys.
So you're like, oh my God.
Yeah.
So at that point, you're at your worst. Fear.
Peer pressure.
Oh, guys are like, here's a joint. Do you want a blunt? Yeah. Kidogo, you've blacked out.
Me, I went to those schools where if you didn't get an A, not an A minus, an A, you were not good enough.
You see?
That was them. Well, they didn't say that, but that was the underlying message.
Yes.
So that used to give me a lot of anxiety in high school. Yeah.
So trauma will come somewhere.
Just reminded me of
it will come from somewhere, not necessarily home, but also from school. You can go to school and be bullied.
Or even your neighbors.
When you're playing outside.
Yeah.
You're thinking, trauma, emotional, psychological wound, and it keeps coming. And unless you deal with it,
I feel like you're triggering.
Unless you deal with it, you'll constantly be on what we call on guard, hypervigilant. Hypervigilant is you're constantly on, you're just scared all the time.
Yeah.
Safe mode. What's happening? What's going on? It's like us, maybe, let's say we live in one house, or basically we're here, we are working, and then we go home, everyone leaves us here working. And then guys break in and take everything and we are beaten proper. The next time we'll sit in the office, we will never be left alone.
Never. I'll be
Never.
the first to go home.
It's time to go home.
Yeah.
4, we are at the door, by the way.
Yeah.
So really, you guys are by that's we're fine. That's we've gone. By 4:30, we are actually downstairs because of the fear of what if it happens again. Now, because you do not want to talk about it, people say, "Awa ni muoga, wachanga za ovyo." Kenyan language. You will keep suppressing it.
Uni muoga.
Uni muoga. Wewe ujui, wewe acha hizo, wewe acha, utiaji. So you suppress. You just never want to talk about it. But one day, it will blow up.
It will transform in your adulthood.
Adulthood, how you survive with people. So you're constantly on guard, then you put a wall. And nobody comes too close to you. So there's a wall that is always there, constant. So nobody tries. So they'll try. They're like serious walls. So you try just to protect yourself. Then question is, how long? Because you'll get tired. It's exhausting emotionally.
Is it really protection? Or I don't know how to put it, because I feel like you're really just describing me, because I used to be like that. Like growing up, I was like a chubby kid, and then people would make fun of my body, and I was very confident. Yeah, so they used to be confused. So they used to think my confidence is like okay, see, I'm fat, so now I'll be confident and fat. Okay, I was not fat, I was chubby. I was like a chubby baby. But then at home, I didn't know I was chubby. Yeah, I had no idea. I knew in the playground that I was a chubby kid. So now growing up, like I used to feel like some of the people I used to call my friends, they would use that as like a way to like, what's the word? Like to bring you down. Like you are here. Now when no, I don't, And then now all of a sudden thick is in.
Yes.
Yeah. Like now it's like now people are literally getting a surgery to have like a body like mine. So I've been trying to understand, how did this thing that was so ugly now, and I've been made fun of like all my life, and then now it's like it's thick. Oh my God, I love your body. You can understand what, and I'm sure someone somewhere has a different like experience of what they went through. But like from a psychology point of view, like how would you be able to help someone through removing what you've said, those walls, and bringing them down, so that you're only, because it's like you're always on guard, like, am I seated right? Is my butt showing? Like, but it's what you're saying. And I think even weight is something very small, maybe something even deeper, like you used to be emotionally abused as a kid by, I don't know, your dad or your mom. I'll give you a really good example. I have a friend of mine who was telling me he met a girl who was loving him in the right way, but he couldn't reconcile being loved like that. He likes the babe who, as in, like, what kind of man are you, And he told me it's because, and I think it's because I'm always talking about therapy, so people are it's so interesting. People are very open to talk to me about like things. So he was telling me it's because his mom used to judge him so much. And so now that he found this really like good, positive girl, he's rejecting her because he doesn't understand how to reconcile. He's more into the girl who's telling him, what kind of man are you? Like, man up. So like, from a psychologist point of view, what would you say about that?
I'll give an analogy, as I always do. When you train a dog, it's a theory we learned in school. A dog is trained. What time to eat? What time it's open for the cage? What time? It's learned behavior. So back to now, how do you unlearn these things? It is learning to unlearn that's not normal.
So we're
for
learning
him it's
to
normal.
unlearn our learned behavior.
Yes, because now it's associated with an irrational thinking patterns. And one thing I always tell my clients is, hurt people hurt others. All right. For instance, my narratives are very main. I'm on fire. God forbid. I'm on fire. Yeah. And then you come and try and help me by holding me with you. Just holding me. I'm like, you'll be fine. You'll be fine. You'll catch fire. Because you've not protected yourself. Now, if you come with a blanket, it will be fine. I'll roll down to get fine, go to hospital and stuff. Hurt people will hurt those who are close to them. And it's not that they do it intentionally. It's because themselves are hurt. So automatically I'll just hurt you. Now for your friend, he's used to being talked to in a certain way. And then a girl who's put together, confident, knows herself, love is like this. He's very confused because this is not normal. Normal is this other one.
This is not his normal.
This is not his normal. His normal is this other chaotic, abusive environment. And this girl brings soberness. So if they're to stay together and he does not deal with him, he will now hurt this one. And then she will carry the hurt to someone else. So that's why it goes down to self-awareness. How am I really doing? How am I really? Sitting down and calling yourself for a meeting. What's going on with me, by the way? What's this that's happening? Yeah? And that's why we always advocate for sitting down and asking yourself those hard questions. Because it is through the tough questions that you get to know who you are, where am I ailing, and what do I do about it. Yeah? So we just need to unlearn the old behaviors, all right, which is not easy, but we keep unlearning every day. That's how therapy now comes in. We untangle the cut with all that oozy all over the place, one by one. So you can find it's generational hurt. You're not good enough, useless, good for nothing. So the same wound that maybe the parent of the mother had is she'll carry it down to her children.
From her mother or her parents or someone in her life.
Yes.
In her
so
childhood.
It's up to now the young man to break that cycle and say, you know what, enough. I will not do this to my kids.
Or so to myself.
So let me work on me. So you sit and work on yourself step by step. First is acknowledging the fact that he told you, I think it's crazy. She's coming. She loves me in a very weird way. This is not normal. Now that's sense of self-awareness. He's realized there's something off. Now the next question is, what next?
So self-awareness is the first thing.
Self-awareness.
And then
what next? Then now courage. Courage comes just calling the therapist. My name is, let's say, Lucy. I need help. There you go. Then the therapist now will walk you through. Take history, understand what the issue is, learn about your childhood trauma, social life, education, what did you go through? Then we do what we call mental state exam. We can do an assessment, come up with your diagnosis, then now go through therapy step by step. Yeah. Initially, let's say for instance, when we did trauma therapy, it was a journey. It was not easy.
It was not easy.
Even for me, it was not easy.
I think I used to cry every time. I would just cry.
And I'd be like, ding, we've done something.
So crying is
normal.
Is a release.
Is a release.
Yeah,
it's normal.
Used to cry. You know, you gave me an assignment. You told me I'm a flower. Do you remember?
Yeah, I remember.
And then you told me to write affirmations about myself. And it was so hard because it's very easy for me to affirm other people, but affirming myself was so difficult. It was so hard. And I was going through this career transition and it was just so traumatic for me. And, you know, I really didn't think we would use this tissue. I thought we were going to be okay. Yeah, I would not be here without you. Like, to be completely honest, like even my mom always says, like, therapy really changed you.
I will start crying, both of us.
Oh my God. So thank you so much. I don't want to cry so much. I think I just want to ask, like, if anyone wants to reach out to you, or if they want like help with whatever issue they're going through, or something that like is getting them stuck. Like, you know, like for me, it was a mindset. It was not the job. It was just this mindset that I wasn't good enough. And I think once we broke that and I started believing in myself, everything has just been like very easy to like navigate. So I think I really want to help someone out there who is right now in a state that I was in when we first met, because you can testify that I was not this
Yeah.
confident or happy or whatever. But like, how can someone reach out to you for help? Yeah.
Before we get there, I was so happy to see you today.
Oh.
And I'm really excited to see you thrive
Yeah.
in the podcast.
Yeah, 'cause
We've
that's where
talked
we're
about
going.
this, I think, for 4 months.
You didn't even know what the podcast was.
What are we talking about? And then I'm listening, I'm like, what are you talking about? So
Yeah.
you actually gave me a reason to actually go try and figure out what is you talk about.
Yeah.
Because I'll be like, so clueless. What are these?
Yeah.
And I'd ask myself, so how will she navigate? Whenever you reach out for therapy, I'm like, Bas, today she'll tell me about things I don't know.
Yeah.
So one day I just decided, let's Google be friends.
Yeah.
So I check, I was like, okay, she will thrive.
Yeah.
She will be okay.
Yeah.
And I'm happy to see you do really well.
Thank you.
I followed you ever since.
Yeah.
I always have a notification on YouTube, LinkedIn, somewhere, Instagram. I'm like, what has she done now? What is she talking about?
Yeah.
And your journey has been a true success, and I'm really proud of you. And congratulations. And I'm so excited to sit in your podcast. I'm so excited. You have no idea.
Yeah.
And this is good stuff.
Yeah.
Now, how do you seek for therapy? Seeking therapy is being bold and just say, oh, the words that will come out. Let me just call. All right. So I will give you my contacts. You will just share it out.
Out like in public.
Yeah, it's
wherever
okay.
we publish this.
Yes. So you can reach me through Noni. She will give you my contacts. Just take that one courage, that one step to actually cross that road in town to get to Ngong Road by just saying, please help me.
Yeah.
We are many therapists. Seek help. I love this young man called Kimani Citizen Guy. Second name is what? Kimani Guy for Citizen. What's his second name?
I don't
I think
know.
Mbogo, I think.
Yeah.
And yesterday I watched his TikTok live. And he was so bold, talking about it, what it went, what it happens, and encourage guys to seek therapy.
Yeah.
It's scary. True.
It's really hard.
It's really
like,
hard.
People shouldn't think it's easy.
It's not easy.
It's really not.
So also for me as a therapist, when I'm going for therapy, as I'm going
And you're
in a
going
few
on
minutes
your way
from
to
now,
therapy.
I always go, oh God, I'm waiting for that therapy session. Jesus. So we have to deal about me. Okay. Because we also need therapy to work so that we can help. Yeah. So it's work. You have to work to be better. Yeah. Just the way we say we are hustling to get the money, you also have to hustle to get your mental health and health generally in check.
Yeah.
Because if you're not healthy physically, emotionally, psychologically, spiritually, mentally, you won't be able to achieve your goals. You will not achieve your goals because something will always pull you back. But the moment you work on yourself, affirm yourself, confidence comes up, and you're able to achieve whatever comes your way.
Yeah.
And also when you have a therapist, they're like your backup. When things hit the fan, but they can you have a session? Let's just talk. Let's do this. But I think I need to offload something that's going on. That's how it always works and helps.
Yeah.
And here you are.
Yeah. Thank you so much, Lucy. Thank you for
welcome.
making the time.
Anytime.
I know me talking with you, we can stay here forever. But I'm so from the bottom of my heart, I would not be here without you. So I am just so grateful. Thank you so much for coming.
Yes.
And if anyone wants, not necessarily with you, if even just help, you can be able to, help someone get a good therapist for.
Well, I'm good enough, but okay.
Oh no, you're the best.
We'll
but in
see
case
where it
if
goes.
someone wants a guy, for instance,
so
right?
they want a guy, it's fine. They might think, what does this chick know about being a man?
So feel free to DM me on at the Plunge podcast or at Noni Mugera on my social media. This has been, I feel offloaded. Yeah, I feel offloaded. This is a therapy session for me. Yeah, and I hope it helps someone out there. So thank you so much, Lucy.
You're welcome.
And
Very
I'm
welcome.
so appreciative of you.
Anytime. I'm a phone call away, as
All right.
always.
Cool. All right. That's a wrap for season 2. Thank you so much for tuning in. Please make sure to make your mind a priority. My name is Noni Mugera, and this is the Plunge Podcast.